Welcome to There's Something About Andover. I'm Nan James, your host. Our program focuses on hospice care, comfort care, and palliative services for patients who are facing life-threatening and final illnesses, as well as the concerns of their loved ones and their family. These families seek to find comprehensive and compassionate care for their loved ones. And so today we hope to be able to offer that with our guests. And we have very special guests visiting us today. On my left is Andrea LeBlanc, who is Vice President of Merrimack Valley Hospice. And next to her is Christine Scaplen. And Christine, you're the development person for the organization.
That's right.
Well, today we're introducing you because you have so much to share with all your experiences and time you've spent professionally helping those patients who have the greatest need at the end of their lives. So we hope to maybe clear up some information and misinformation about services that are available for families who have great need of your care and concern. So let's start by helping us to understand just what hospice is.
Yeah. Well, thank you very much for having us. And I think hospice is very misunderstood and underutilized. And hospice is really about living more than about dying. And Medicare established that hospice was a benefit at the last 6 months of life. And unfortunately, often it's less than 6 weeks that people choose to have hospice. So we really want to provide support at least for those 6 months so that families can understand what living can be done in those final days.
Very good. Well, how and where are these hospice services offered to us?
So hospice can be provided wherever someone calls home. So that might be someone's private home, it might be a facility, a nursing home, it could be at our hospice house, it could be actually in a hospital, which is not really where people choose to die, but sometimes they're so critically ill that they can't leave the hospital and we'll go to them.
Oh, that's wonderful. And how do you decide what services are needed for the patients?
Yeah, so services are really about the patient's goals, both their medical goals and their personal goals. So we make a plan in collaboration with the patient and the family and the care team. And we have a really extensive care team. And the head of that care team is the physician. So the physician who knows the patient best, as well as our medical director.
And how are patients referred to you? Is it through the doctor or is it through other sources?
Yeah, so I'm sure Christine's going to help me with this as well, but there's many referral sources. Often it's from a hospital. It may be from a facility where people live. It's also patients' families or the patients themselves may refer themselves.
So they can contact you directly if they wish to do that?
They can. Right.
Well, we'll get to that information a little bit later in the program. Now, you mentioned the professional team that helps and supports the patient. Who are all these professionals?
So the Medicare benefit really provided for an extensive team, and almost all insurances have followed suit. So as I mentioned, it's headed by really the patient, but then the physician team, the nurse, a social worker, chaplains, the home health aide who sees the patient probably more than any of the remaining team. We provide bereavement services for up to 2 years once the patient passes. And I'm trying to make sure that I didn't miss anybody. The most important part is our volunteer team. So we have nearly 300 volunteers in our hospice program.
Oh, that's amazing.
It is amazing, yeah.
But when I read the literature on your organization, I noticed that you offer services in 90 towns in the Merrimack Valley?
Yeah, I actually believe it's over 100 now.
Oh my goodness.
It is. We see patients in the places that they call home, and we do care for over 100 different communities from northeastern Massachusetts, the Merrimack Valley, southern New Hampshire, the Seacoast region, and through our York Hospital Hospice operation, even into the York Seacoast region. So
That's amazing.
we have caregivers who are there with patients in their homes, volunteers in their homes, providing the services there for people where they're most comfortable.
Well, what is the kind of information that's needed for patients who are ready for your care? And if they have a referral, what information are you looking for?
So what we need to know is what is the life-limiting illness? So what do they understand about their care, and why do they think hospice is the right thing for them? Often they call us because they just don't know when is the right time, and people wait way too long. Sometimes they think the last few days of life, or you'll hear families say, well, we better call hospice, it looks like they're passing, you know, and we have had patients with just a day or two to live. So what we want people to know is to call us sooner than later, to have conversations with their physicians about, is hospice appropriate at this point? And there's some science to that prognosis, but it's not really black and white. There are many elements that we consider when looking at different diagnoses. And the other thing is, often people think it's just for cancer patients, and actually hospice spans almost any diagnosis you can think of towards the end of life.
Now, what kind of care or what kind of services could the patient expect to receive from hospice?
So when they're referred to hospice, we send a nurse out to do an assessment, and they'll receive at a minimum nursing services, and it could be once a week. Initially, it could be 3 times a week, it could be 5 times a week, depending on their need. And what we know about hospice patients is that it ebbs and flows. You know, they might come to us feeling really unable to leave their home or unable to do much. And as we add supports, they feel better, which is what we want, so they can live. And then they might need less for a little bit. And then they might have an episode where they need a little more service. So nursing services, social work services are often used to talk to them about what are their goals. And they could be things like going to my granddaughter's wedding, or going to my son's graduation, or making a trip to the Bahamas, aside from the pain and symptom management.
I love the trip to the Bahamas.
Yeah.
I'll take that one.
Yeah.
If I could just extend a little bit further with some practical types of things as well. You know, when you look at hospice, it is, as Andrea has said, to how do you want to live your remaining days? How do you want to live that time, however long it may end up being? And with the services that hospice does provide for symptom management, pain management, it may relate to nutritional needs to help someone to regain strength. It may be to help with anxiety or problems that people are having settling down or being able to sleep, so that they can in fact conserve some of their energy, re-strengthen themselves. There are times, as Andrea said, where patients have sort of head in a more upward direction in terms of their health and their well-being, simply by having the right kinds of care. And there are, by having the right services, you can make that time more comfortable in many cases,
And happier.
And happier.
able to enjoy, instead of being able to have those conversations with the family and friends that you would like to have close to you. So with the right kind of medical management of care under the hospice package, it helps. Additionally, we also have expressive therapies that assist people in sometimes coming to terms with their own life-limiting illness or advanced stage illness. And those aspects of hospice lie outside of the medical component of hospice, but are part of the emotional and the spiritual support that people may need to better cope with their own situation and their family to be able to address those issues.
Well, now that we've provided some understanding of the services and how the patient could potentially benefit, I want to know who pays for this.
Yeah. So, as I mentioned before, Medicare has set up this really nice benefit. So if you're a Medicare beneficiary, you can receive hospice. Medicaid also pays for hospice services. Most commercial insurances cover hospice. And we are a nonprofit, so we also provide care under philanthropy as needed. So we really feel that people should talk to us before they think, oh, that can't be something that I could afford.
Now, is there an appropriate time for a patient to join the hospice program?
I would say sooner than later, because no matter when they call us, I can tell you it's going to be later in their illness than it should be. I think people falter towards waiting than calling us. So I would think if the thought crosses your mind, call us so that we can talk about that.
So the patient can call you, the family can call you, the doctor can call you.
Right. And the other thing I wanted to say about who pays for this is under the hospice benefit, unlike any other of the health benefits, medications and equipment such as a hospital bed, a commode, IVs are all covered under that benefit as it relates to the prognosis. So I think the sooner people call, the better. And the other thing I think people don't understand is that there's been research that shows when you have palliative and hospice services, you're actually likely to live a bit longer than if you didn't have those supports.
Yes. So now we've talked about the patient requiring services. What do you do for the families? How do you help them?
So it's not the patient separate from the family, it's the patient and the family right from the beginning, and whoever is defined as the family. It may be a significant other, it may be a neighbor that's helping to take care. So the social work services, the chaplain services, the volunteer services, and the bereavement services especially are all focused on not only the patient but the family as well.
Oh, that's great. Now, if a patient isn't able to have hospice service in their home, what are the alternatives for them?
Right.
Beside the hospital setting or something like that?
So as I mentioned before, if people need to go to a facility and receive hospice services, there will come if they choose to live in an assisted living or an independent living setup. But also as people become critically ill under the hospice benefit, what I call the crisis care of hospice, which comes and goes, they can come to our hospice house, which has 21 beds, and the families can come and stay. There's suites for every bed.
Amazing.
Yeah, and so all the services we talked about are there at the hospice house.
Well, you know, if our viewers would like more information as to how to reach hospice, perhaps you can help me tell them and show them too. First of all, the phone number. You do have an 800 number.
We do.
We do. The general 800 number where people can find out information about hospice is the, we have an 800 number set up, which is 1-800-333-4799. And the local number is 978-552-4444. And you can contact that number for additional information to set up or if you have questions about a referral or what your next steps might be. And I think it's important for people to know that they're not obligated to enlist in hospice services, to begin that level of care. To make that phone call is simply to begin to understand a bit more about what hospice is. And
there is a website.
There is a website, merrimackvalleyhospice.org. So merrimackvalleyhospice.org. that has information in general about hospice, and it also has information about Merrimack Valley Hospice House, which is located in Haverhill, Massachusetts. There is a wealth of information around that as an option. Additionally, many of your viewers may have seen an insert that was in the Andover Townsman newspaper as well as the Eagle Tribune.
Yes, it was.
And if for some reason they don't have that around, they can also request that from us or find it electronically on our website as well.
That's
And that
great.
really showcases some examples of people who've used hospice, as well as a little bit of understanding of the types of services that are available.
Well, you know, I think in conclusion, we should really think about all of the benefits that hospice has for the patient as well as the families. So some of those benefits that are very real to the patient would be what?
So certainly it's the medication management, symptom management, understanding the goals that people would like to reach, whether medically or personally. We mentioned the expressive therapy, which I think is such a wonderful asset in our program that helps families and patients express themselves, whether it's music therapy, pet therapy, Reiki, massage. There's so many supports for families.
Well, we certainly appreciate your taking the time from your schedule, and it's wonderful to know that there are a group of professionals and volunteers who are very willing to help patients whose needs are the greatest in their lives. So we thank you so much for
Thank
joining
you.
us today, and
Thank you.
hope you'll come back again
Yeah,
someday.
would love to. Thank you very
We
much.
would. Thank you very much, Dan.